Thanks for staying with us. So according to reports, remember, it's our Healthy Tuesday, so we have our doctor segment here. So according to reports, more than 1 billion people around the world live with hypertension, which is high blood pressure. It's a major cause of cardiovascular disease and premature death worldwide. In commemoration of World Hypertension Day, we have a consultant cardiologist at Federal Medical Center, Ibutimeta, Lagos, Dr. Oladeji. Welcome to the show.
Welcome, yes.
Sir. Good to have you.
Good morning.
Good morning.
Yes.
So we hear about this high blood pressure all the time, hypertension. I know we've talked about this several times, but let us, for those who don't have an idea, what exactly is hypertension?
All right. Thank you very much for that question. Hypertension is defined as a blood pressure at which there's more benefit in treating than not treating. So a value has been set for that, and that value is any value greater than or equal to 140/90. Now, the 140 stands for what we call the systolic, the one above, and the one down is the one we call diastolic. So is that greater or equal to 140 or greater than or equal to 90. So when any of these values are above that cutoff mark, that person is hypertensive.
Yeah, what are some of the causes you have seen of hypertension in the first place?
All right, thank you for that question. So causes of hypertension can be classified into modifiable or non-modifiable causes. Now, what do I mean by modifiable? That is what you can do something about. The non-modifiable is what you cannot do anything about. So starting from what you cannot do anything about, which is a non-modifiable, age is a strong risk factor. So the older you are, the more at risk of hypertension. And that means, from statistics, people older than 40 years, there's a prevalence of, you say, for every 10, there are 3 to 4 people with that. And the older you are, for about those greater than 60 years, out of every 10 people, there are 6 that are hypertensive. So age is a strong risk factor. Then,
have you checked? Sorry. Go ahead. I'm sorry.
All right. So then also sex. Males are, hypertension is more common in males compared to female. Then the race, blacks. We are Africans, so we are more at risk of hypertension. So for the modifiable ones,
Nigerians too.
Nigerians, we are.
Nigerians.
Yeah.
Especially in this season, Adelabu season.
So for the modifiable ones, there's the sedentary lifestyle. People don't move around. You watch much TVs. There's obesity. There's cigarette smoking, excessive alcohol intake, and stress, because these are stress is now recognized as a risk factor of hypertension.
So that brings me to my own question, because I was going to ask, you know, a lot of people exercise. Yes. Do you think if you exercise, you still have the tendency to have high blood pressure?
All right.
You exercise on a regular.
Okay, so talking about exercise has been, is what we advocate. It's part of lifestyle modification, which we put under non-drug treatment for hypertension. So for people that exercise, the number one, if they are not hypertensive, it delays onset, because like I said, age is a risk factor. So that you are not hypertensive this year, once you have crossed a particular age, does not mean you are not next year. So that's why you have to regularly check your blood pressure. Then for people that are not hypertensive at all, if they regularly exercise, they will delay this onset. They might not get to that level of being hypertensive. Then for people that are hypertensive, if they have not gotten to the level in which they should start medications, they might be able to modify this risk and not commence blood pressure medication by regular exercising.
When you say check regularly, how often?
All right. So checking blood pressure depends on, if you check this year and your blood pressure is normal, you can give an interval of like a year. But if you are already hypertensive, it has to be more frequent than that. And the frequency depends on whether you have achieved control or not. So for some, if you just commence treatment, it might be every day for like a week. But for some that have achieved control, it might be like once in a week.
Right.
Yes.
What I hear you say, there are just 2 classes of people. hypertensive people and non-hypertensive people. The reason why I said that is because you said there's only, whatever lifestyle you do can only delay the onset. That's what you said about the exercise question Waike was asking. So it's not like there's a thing you can do that even when you are predisposed genetically to hypertension, that would completely wipe the chances of you getting to that point out.
No, yes, you're right. In terms of the risk is ongoing. It's a lifelong risk. So some people say if you live long enough, you might be hypertensive. But some are lucky that they won't be hypertensive throughout their lifestyle, depending on the kind of lifestyle modification they adopt. Because there are lifestyle modifications that if one do them, you might not get to that level where the blood pressure is high and you are diagnosed hypertensive.
Now, men have a problem with these drugs because I know someone who is taking hypertensive drugs and that thing is not working.
How is it not working?
Yes, they need to change it.
They need to change it.
Okay.
What happens when?
So talking about drugs, there are many classes of hypertensive medications, and they have been well researched into to know which one men should take, which one females can take, and which one is safe in pregnancy and which one should not be used in pregnancy. So like the one you talked about that will not cause erectile dysfunction, there are some of those hypertensive medications that will cause it. But if you meet a doctor, they will not put you on that. So there are safer medications that will not actually result into erectile dysfunction.
But you said it's not working. You mean that the drugs...
Not responding to
No, the drugs are working.
But,
is the thing you're saying? I didn't understand.
And that is very frustrated.
Oh,
Yeah.
I didn't understand. I didn't get that.
You had girlfriends all over
How
the place
did
now.
she communicate that? I didn't
I
understand.
know,
That
because it's a common question, it's a common concern with our
I thought she
patients.
meant that the high blood pressure drug is not working. We normal people, the senior citizens understand that conversation.
no,
So
we are
mind
decent.
them.
There are people who use the drugs and
Okay.
they don't see the result. It doesn't work on them.
Yes, that's the
what
question
I
I
heard.
thought. That's the question I thought.
Okay.
But why can't
Our
the
mind is
doctor
clear.
All right.
and they understand themselves?
No, our minds are clean.
No, because go to
63-year-old.
you understand 63-year-old question. He understood immediately where you're going. We did not understand. But go ahead.
Okay, so talking about the erectile dysfunction is actually a common question you get from the male patients that are hypertensive. And for me, I always tell them, for example, like I said earlier, hypertension is commoner in people that are old. Erectile dysfunction is also common with age. So it's also, hypertension also itself can cause erectile dysfunction. The drugs also can cause erectile dysfunction. So the question is it the chicken before the egg or the egg before the chicken? So choose one. So it might be that the person already have the erectile dysfunction or
He didn't have.
at all.
So an issue was already brewing.
I said he had girlfriends all over the place. He had about 3, 4 Now, our girls will pay
And that's where his power is.
Could that be a problem? Because it's baleje, that's why this is not
so
working.
it might be that the medication that the patient was placed on, but the medication can be switched, and if it's due to drugs, it will actually pick up, and the person
So
will...
we have a number of people who just sleep and not wake up. They die. They are driving and just, go from the steering.
Yeah.
It's been reoccurring of late. And some persons will say probably they had hypertension, which was not monitored over time, and they are not even aware. How do we get people to constantly check their status?
Is that even true? How does it even happen?
Yes, or how does that even happen?
Okay. Now, when we talk about symptoms which people complain of when they have hypertension, most of the time, there's no symptoms. And that's why we call hypertension the #1 silent killer. There might not be any complaint, and the first presentation is sudden death. And that's why the only way, it's not written on the forehead, you might not know.
Hey.
That's why the only way you know you're hypertensive is actually checking the blood pressure. Is in doing it, checking the blood pressure.
So you can be healthy.
You can be active, there might not be any symptoms, there might not be any headache, there might not be any blurry vision, there might not be any chest pain. And the first time the person is noticing that there's blood pressure will be sudden, then him getting to the hospital, presenting in emergency.
Right.
And presenting with stroke, presenting heart failure, presenting with kidney disease. So that's why there's a lot of advocacy on making people to get aware of hypertension, that you should check your blood pressure. And that's why the theme for this year from the World Hypertension Society is know your numbers. You need to know your numbers.
But how accurate are these digital ones that they are selling? Because I have like, my mom too. My father, we have it too many in the house, and I'm wondering, sometimes I think these things are just too many. There's the wrist, there's the, so which one is accurate?
All right. So, like you said, there are many blood pressure apparatus, from the mercury in glass, the old one that you see nurses use where you use the stethoscope. There's also the digital, where is the ham. Yes,
you can buy and take home.
You take home. There's the wrist. Okay. So, like, everything is evolving. Technology is evolving. The old one that we normally use, which is the mercury in glass, it's been said that the mercury has it can be poisonous if it breaks, so it's been phased out. Actually, you can only find that in Africa or third world country. So what we actually use now, and we advocate, is the digital, but the arm one, not the wrist, not the fingers, because there are a lot of things. Now, why is that? For the blood pressure to be accurate, the arm where you are checking must be at the heart level. Okay, so any other thing you are checking does not reflect the pressure in the blood, in the heart, yes, or in the pipes. So now talking about how accurate are these digital. Now there is a website where you can check whether your instrument has been validated, where you check your instrument that you're using. Yes. So, or when you buy one, you can take it to the hospital, see your doctor, and they will check. So they will use yours to check your blood pressure. Use that that has been well calibrated and validated to confirm and correlate. I do that for some of my patients.
Let's talk about the use of salt. Okay.
Sorry. So when you say heart level, how do, because at the hospitals they do the hand like
No.
Is that heart level?
They say like this.
Now,
they say like this.
No, so you check like this. Your table has to be a bit high to support the hand. So your heart is somewhere here. So it will be at the heart level, so that.
No, so
you are not going to check your blood pressure
So you
like
can't
this.
do like this.
No.
Let's talk about salt for a moment, because some people just say stop eating salt. Once you stop eating salt, you have good high blood pressure. Is that correct?
Okay, that is not totally true, but there's some element of truth in that. Now, like I talked about earlier, that in treatment of hypertension, there are two ways. You talk about lifestyle modification, and you also talk about drugs. So once, for people that their BP is not elevated, you talk about lifestyle generally. So one of those lifestyle modification is salt. So we advocate reduction in salt, because salt is also still good for life. So the way to communicate, there's the dose that is recommended, but how practical is that? We talk about 1,500 milligrams per day, but how do you quantify that? So what I tell my patients is that, or people generally, is that, for example, if your soup is already tasty, you don't need to put that in the rice. So that balances out. So it will just be, the food will just be there. So and when you are eating, you don't add extra salt to your meal. Then and it's not just only salt in food. There are many other things. Yes, seasonings, even drinks. Yes, even drinks generally, even some Pringles, many snacks have quite a lot of salt. So you should actually watch.
Out of these MSG, these seasoning cubes that they say the content of it, the magnesium something inside is dangerous.
Yes, so I think that has been flogged for many times, where it has been phased out of market because of the content of that particular MSG and its danger, not just hypertension.
Ones that are doing their marketing.
It's still there. I've stopped using those seasonings. Yeah.
But it's
be careful, though.
Yeah. Can I
don't let them not sponsor also. Be careful.
So I know that there are people who have the low blood pressure.
Okay.
Is that also a form of hypertension?
Okay. No. Low blood pressure, it's actually not. Hypertension is, you are talking about high blood pressure.
Okay.
So low blood pressure is usually not much of concern, except the person has symptoms. So what do I mean? There is a classification for what is normal and what is abnormal in terms of blood pressure. Anything less than 120/80 is optimal, is normal. okay? And between 120 to like about 129 for the up, 180 to about 84.
I do 110/70, for instance.
110/70, that's normal. It's a range. Now,
But it goes down
okay,
when I'm ill or pregnant.
pregnant, okay.
It goes really down. So sometimes, I think the last conversation I had, they said it's a problem as well because it shouldn't be that low. So that's what I wanted to. So what's the problem with that one when it goes really low?
Okay, so like what you said in pregnancy, blood pressure in a particular semester in pregnancy, blood pressure can physiologically go down. But it won't be a concern if there's no symptoms with it. You don't interpret the value in isolation. Now, you have to compare, is there a complaint like weakness, dizziness, fainting? Yes, so for that, that's a concern, that's an issue. So you have to probably rehydrate the person. So there are some conditions that cause blood pressure to be too low, like if you are vomiting excessively, if you are stooling, diarrhea, if you are not eating and you are dehydrated. So like this kind of weather, when it's sunny and you're losing water through every means, blood pressure can be low. And when it's low and there's symptoms, you have to rehydrate that person.
Yeah.
So
Let's go, jump in here.
Yeah, I was going to ask, there are times when if you measure this hand, like, last time I did my own, I measured this one, I was 120. When I did this one, it was 137. What does that mean?
all right. So that's actually like the way all the parts of the body are not equal. Blood pressure are not the same in the two arms. So what we do is, the first time you come in a clinic setting, we check the two arms, okay? Then from there on, we use the higher one to keep monitoring. Okay, so it's not a concern if one is greater than the other, but it becomes a concern when the difference in the two arms is more than like 20 millimeters of mercury. That's another condition on its own that will now be evaluated. There are some clinical conditions, a narrowing of vessels that gives that. But when it's like less than 10 millimeters of mercury difference, it's not a concern.
Because of time, let's take a
concern because 137, 120, that's
137, 120, that's quite
high.
Right, yeah.
So maybe they need to just investigate you more, do some investigation to know whether
it's the champagne. It's the champagne. She won't talk. She won't say that part. Just when she's the champagne. Okay. Please, medication. Because people are saying the cost of medication, is it affordable now too? Because they keep changing the numbers and they keep telling you to change a new one. I know when my mom was alive, she had changed a few medications over the years. So how affordable is the hypertensive
medication? Medication all your life?
Yeah.
Okay. So let me start with what you talked about, whether you be on medication all your life is actually one of those things when you tell a patient that you'll be on medication, they're like, is it for all my life? So now, for most of people that have been diagnosed hypertensive, because when your blood pressure is more than 140/90, for the first time, you are not automatically just commenced on blood pressure pills. You'll be asked to go home, relax, and fix another day to recheck again, commence lifestyle modification. But when it gets above like 160, 110, that person will be commenced on medication. And when you are commenced on medication, that medication most likely will be for life. But the dose might be modified if you are optimal in terms of the lifestyle modification that we have talked about, like exercise, we talk about weight loss, we talk about reducing salt in diets. In a proper meal, the vegetable has to like make up like half of it, protein making a quarter, carbohydrate making another quarter. So if you are optimal on this, all these contribute to reduction in blood pressure and the dose will be adjusted. For most, up to 80% of people, they will be on the medication for life. Wow. Most of the time, the only time when maybe medication will be withdrawn is when in a situation like pregnancy-induced hypertension, where hypertension is in pregnancy. After pregnancy, for some women, it becomes normal. So for those people, they will be on watchful list that's monitoring to see whether it goes up again before they are recommended.
You think that by 2024, that more technology research would have been out by now for us to have new, because I'm hearing so many drugs people are using in the US now that it totally removes this issue of hypertension. I don't want to mention it on TV, but the thing is that, do you think there's more research being done to eradicate it completely?
Okay, so one of the most investigated medication in the market, in the pharmacological industry, is actually hypertensive pills. So these medications have changed over the years. And most of the newer medications are not just about lowering the blood pressure, it's also about the protection they offer in terms of heart protection, kidney protections, and the brain protection, the eye protection. So it's more than lowering medication, lowering the blood pressure. So talking about technologies that will take away research, taking away blood pressure completely, I would say that the technology that have been technology comes in once in a while, but there are some that are validated that crosses like the pass mark that could be used in population. So this technology are for resistant hypertension, not to cure. Yeah. It's just to lower, to control it, but you still don't stay off the medication, and lifestyle is still there.
You have to wrap up.
Yeah, Moses Ade is asking, what are the common side effects of these drugs?
Okay.
So on YouTube, he's asking Moses Ade. All
right, so the common side effect of this medication, like forms a class of medication called ACE inhibitor, there's dry cough. Okay, some of the medication like amlodipine, there might be leg swelling. Some of the medication like Aldomet, for males, there might be erectile dysfunction. Okay, then for some of there's a class of medication called diuretics where you lose potassium, sodium, where it has to be.
You lose certain minerals.
Salt, yes, salt and sodium. So if you lose it to a level which is dangerous, you'll be supplemented with this supplement, yes, to adjust this.
YK and BC are very worried about erectile dysfunction. Don't worry, your spouses will not have it.
They will not have. No, we don't give men these medications, yes.
Before they call me and accuse me of it, so please,
I said this guy I know. If you see how he laments.
So I would just advise he sees his doctor, he complains about medication, so
okay,
he can be actually
changed. That is a spiritual problem. How can you ballet and expect your thing to be functional? Of course not. He has ballet. You should forget about it. He's spiritual. MFM, not ballet.
That is like
MFM.
But it's actually for male. It's actually a lot.
It's a lot now. Your ego is damaged.
It's mental health.
It's part of our ego.
Please.
Yeah.
That's all we can take on today's show. You ballet, you now say, of course you'll be erectile with dysfunction. That is all we can take on today's show. Hope you have learned a few things as we have. Thank you, Doctor.
Thank
you, Doctor.
Thank you.
Have a great day. We'll see you tomorrow.
All right.
Bye for now.
Bye.